So just in terms of the overview of the presentation, I'm just going to do a quick overview of mental health and adolescence, because as I'll explain, it's a very unique subgroup with many challenges that are experienced by them as adolescents, particularly in today's difficult society and these difficult times, as well as difficulties in treating adolescents as a group, because they present unique challenges, unique from adults and also unique from younger children as well. And recognizing mental health difficulties in adolescence is also challenging. So I'll try and give you some tips and tricks, as well as some rapport building strategies. It can be, rapport is very important in whatever you're doing in medicine, but having said that, within psychiatry and mental health, as well as in adolescence, it's even more important and challenging to do so. Also, I'll give you some red flags, things that you should worry about if confronted with an adolescent with a particular mental health problem or a particular presentation. Having said that, bringing it more to the current difficulties and dilemmas that we are facing, but common concerns that I am facing at Red Cross during a pandemic, and things that you are likely to see as well. And then I've got about a 5-minute clip from by the Anna Freud Foundation, whose Anna Freud is the daughter of her more famous father, Sigmund Freud. And this video clip is it's a nice summary of adolescent mental health, but it also shows some of the difficulties and challenges faced by adolescents and in diagnosing adolescents. Having said that, this particular clip, unfortunately, is very Eurocentric. So it's from the Northern Hemisphere in the first world country, but I still thought that it would be applicable to our setting, as there's certain things that can be gained from that. And then we have time for questions. I also just want to apologize to everyone. My dogs are currently outside and they're not used to being outside, so they're busy crying. So if you can hear them crying, nobody's torturing them or killing them. They're just wanting attention, which I cannot give them 24 hours a day. So moving on. So in terms of mental health, and this is really important at any stage, is that it's not separate from physical health. I feel that still, as a medical student and even as doctors, we tend to separate the two. And it's actually, they're both very interdependent in terms of influencing each other. So mental health can influence physical health, and physical health can also have impacts on mental health. And looking at other things like spiritual health or emotional health, societal health, and the relationships you have with those around you and with yourself, it actually is it's one prong of health, and it's interdependent and affects every other prong. So it's something to really be considered. And having said that, the needs, as mentioned before, needs change as children grow and develop. And what happens during adolescence, and it is controversial between experts as when this period of adolescence actually starts. And for me, as a healthcare professional, I really think it's really unique for each particular person. I know that in terms of physical development, you have specific processes that you go through. So for example, the Tanner stages for physical maturation based on hormonal development and things like that. But in terms of a mental development, it's really very individualized, and it can and should coincide in theory with the physical development. It doesn't always happen. Um, and and it's very unique. We often see some very much younger kids, like let's say 10 and 11 years old, who you wouldn't expect to be forming an adolescent identity, and they are. And then you get some 16 or 17 years old who has still not made that mental transition into adolescence and potentially adulthood. So it really depends on the individual child. And it's really a time trying to form your own identity separate from that of your nuclear family. And when I say nuclear family, I'm not necessarily just referring to your mom, dad, siblings. It could be anybody who you really truly identify with from a young age. Usually it is the immediate family. It sometimes can be, in cases of where children do not have a nuclear family, it can be a foster family, it can be a children's home. It really is trying to form an identity that is separate, a sense of who am I in this world that I am in. I'm not just part of a nuclear family, I'm a part of a larger societal role. And I think in terms of mental health, that's really important to distinguish, because that's actually a preparation for adulthood, because that's, we hope that most adolescents and teenagers would grow into adults who would be conscious um, of having a role, a larger role to play within in society. And then in doing so, peer groups become more important. So peer groups, especially in schools, in other activities, be it religious activities, cultural activities, sporting activities, any extramural activities. And in some unfortunate way, in particularly in Cape Town, we have some vulnerable young, particularly boys, but I suppose girls as well, being involved in gang culture, because it forms, it's an identity outside of the nuclear family, and the gang culture becomes almost like a role model for them, a negative role model, but a role model nonetheless. And it's obviously a cycle that we hope to break. And there's really unique challenges in managing mental and physical health conditions within adolescence. So part of the challenges, and I've alluded to this in the previous slide, is that the need of wanting to fit in becomes important, and fitting in outside of the nuclear family. So also not wanting to be perceived as different is really important. So it makes challenges very difficult. So for especially when it comes to medication. So a common challenge we have is children and adolescents with attention deficit hyperactivity disorder, ADHD, not wanting to take medication at school, understandably so, because they don't want to be seen as different from their peers. Um, why do you need to take medication? Or they don't want any questions about that. Also, there's a greater need for independence and a need for privacy. And also, unfortunately, and the video will touch on this, the perception that they should be handling problems and issues on their own. They're not wanting, there's a greater sense of their role within the family and society, and also not wanting to be perceived as being a burden. Another issue that we have in managing adolescence is, for example, the influence of media, including social media, celebrities, and the current status quo. So that's why it's really, really important. And I don't think celebrities know this, or they may be aware of it and not giving enough care to this issue. But what they say actually matters. So me as a psychiatry medical officer or psychiatrist even can go and say something about bipolar disorder. But if Kanye West says something about bipolar disorder, they're going to believe Kanye West. Um, Unfortunately, that's very much true. So it's really important that the information that's given out is accurate information. Having said that, celebrities will always have a greater status amongst society, especially with adolescents. And then, as mentioned previously, within the South African context, specifically within society now, we've got the scourge of gender-based violence, gang violence, illicit substances, and something I didn't add here, but I thought about later. It's not just illicit substances. We're talking about things like cannabis, cigarette smoking, and alcohol, all of which can have effects on both mental and physical health. Other issues such as discrimination of all kinds against the LGBTIQ community or xenophobia can also impact teenagers' mental health, which is very challenging. So in terms of recognizing mental health difficulties in adolescence, it is tricky. And I think, as I mentioned right at the beginning, establishing a rapport is actually key because if you don't establish a rapport, then you might as well give up. It's really difficult with certain adolescents to develop rapport, and with other adolescents, it happens very easily. So it really depends on the child or the adolescent in question. Also, don't be too hard on yourself. If you're speaking to an adolescent and you feel like the rapport isn't there, just providing a space when adolescent can talk is very therapeutic in itself. I think that um, is is really important, and also differentiating normal feelings from something that is pathological. So, as it will show in the video later on, is that what we tend to perceive as negative is not necessarily abnormal. So, for example, feelings of sadness is absolutely valid and normal in a context of losing a loved one, or feeling stressed before an exam is a normal reaction to to a performance-based assessment that you'd have to do. Um, Feeling a sense of grief when losing, as again, losing a friend or losing a loved one is normal within that context. And when does something tip into from being a normal reaction to being something that's pathological? And that's really a philosophical question that has plagued psychiatry and psychology for many years. And I think for us now, it's when it becomes to the point where it's affecting the person's societal and occupational responsibilities to the point where they are incapacitated by their feelings and are unable to manage their normal responsibilities. Um, and really, in this current circumstance of the coronavirus pandemic, um, there's really there's a lot of teenagers and adults and children that are experiencing a normal reaction to a very abnormal situation at the moment. So a lot of people are describing they're feeling stressed, they're having weird dreams, they're having a great deal of difficulties in accepting this new normal that we're moving to, and really that is a normal reaction to an abnormal situation. And it's really important to ask questions sensitively to adolescents. So please, the first question shouldn't be asking the adolescent about their sex life if you haven't gotten a basic rapport with the adolescent in question. So really just how I do it is I ask what I call the more safe questions first. I ask them about themselves, where do they stay, their nuclear families, and what do they enjoy doing? What are their hobbies? What are their interests? What music do they listen to? What books do they enjoy reading? And then depending on how the rapport is established, I then move into the more sensitive topics. So in terms of hygiene habits, possible illicit drug use, eating habits, academic performance, and things like that. So just it's really important um, to to approach things very sensitively. And also, I always start an interview by saying, if there's anything that you feel uncomfortable answering, please just let me know, or don't feel under any pressure to answer any questions that you're not comfortable with answering at this current time. It's something we could address later, and we can take it from there. Okay, so here are some tricks. What I like to do is that I try to mainly start the interview with open-ended questions. So questions that don't make it too closed off for the adolescent to open up. A nice way to establish rapport in a safe-ish way is to, once you've introduced yourself, and is to say, tell me about the average day in the week. What do you enjoy doing? What are parts of the day that you look forward to? If you go to school, what subjects do you enjoy? Um, and what parts of the day do you not like, or you don't like um, interacting in, or you don't like doing things in? So, for example, um, it can also be a red flag, and it can tell you a lot. So, for example, if the child's favorite part of the day is going to school in the morning and they enjoy going to school, and then they tell you that they don't like coming home, then you need to kind of, it's a red flag for me. So, why is the child not wanting to come home to the home environment? Is there something that's happening at home that's dangerous? Is there something that's happening that's not good? Another question, what do you enjoy doing when you relax? What do you find fun? And are you still enjoying the things that you used to like? And if you're not enjoying the things that you used to like, why do you think that is? This is quite important to establish, because what I'm trying to establish here is features of depression. So I'm not too sure what year you guys are in, but one of the features of depression is anhedonia, so the feeling of not enjoying things that you used to enjoy. Having said that, in adolescence, it's different because sometimes people just have changing interests. So, for example, if there's a person who used to enjoy playing soccer and he says, no, he doesn't enjoy playing soccer, but now he enjoys playing rugby, it's just a shifting interest. That is not anhedonia. That is just something as he's growing and developing, he's discovering a new interest. Or if somebody says that they used to enjoy ballet and now they enjoy playing the saxophone, that's also something that's just developing. Um, and I think the next question is quite an important question, is that if there is something bothering you, what is it that you do? Don't just assume that teenagers will talk to others. Some teenagers won't. They might do something else like journaling, artwork, playing music, play sports. But I think it is important to ask, is there someone who you do like to talk to? Or is there something else that you like to do? And do you think that there's anything else that, or do you think that how you manage difficulties is useful? So I think that's quite important, because a lot of teenagers, particularly in the age group, let's say 13 to 15, but even slightly older than that, self-harming starts. And when there is something bothering them, instead of talking or expressing the distress verbally, they express it physically by harming themselves, and the physical pain detracts from the emotional pain. Sometimes teenagers will speak to self-harming and say, no, they bite themselves or they cut themselves or burn themselves. And as mentioned before, what do you enjoy doing with family, with friends? What are your favorite subjects at school? What don't you like? And another thing that I forgot to put in here, but something that can be quite useful in terms of measuring mood, because mood is actually quite a difficult thing to measure in anyone, because it's something that fluctuates with time. So, for example, what I do is I use it on a scale. So I'd say on a scale of 1 to 10, 10 being the happiest you've ever felt on, let's say, a good day, maybe it's your birthday or something really exciting has happened. Um, how would you rate yourselves? And 1 is like a really bad day where you're feeling very sad or depressed or tearful and something really bad has happened. Where would you rate yourself today? And how is your mood usually? And what are some of the things that make your mood go up? And what are some of the things that make your mood go down? So that can really help. Obviously, it's a very subjective scale. It's not objective. So one child might say the mood is a 7 out of 10 and be very objectively sad. And somebody else might say their mood is 3 out of 10, but might actually be euthymic. So it really depends. You need to just tease it out with the particular patient. Um, so an important aspect, just in thinking about adolescent mental health, are some of the red flags. What are some of the things that we're concerned about? What are some of the things that that are, when I see a patient, that I worry about? So, for example, change in habits, including eating, sleeping. Those are the two main ones. Um, that will alert me if there's a deeper underlying issue. Eating disorders are becoming more and more common. And before, we used to think that eating disorders was predominantly something with adolescent girls. It's not. We increasingly seeing more and more boys with eating disorders as well. Um, Issues with sleeping, particularly around anxiety, difficulty falling asleep, or getting up multiple times a day. What can give you a great insight, especially with regards to sleep as well, is dreams. What sort of dreams are they having? And it's not so much the content as it is a much about the theme of the dream and how it's perceived by the patient, because it can tell you a lot about the child's waking life during that time. Libido, it's just important to note that adolescents are sexually active, and it's something that needs to be approached very sensitively, as you can imagine. So it's something just to ask about in a very sensitive way. Interacting with not with patients, interacting with their peers and their families. So an adolescent that was generally very interactive and able to engage well with their families. If the family raises a concern that my son or daughter is not interacting as well, or isolating themselves, that can be a cause of concern. Grades is a big one. Oftentimes, teenagers who have difficulties, mental health care difficulties, their grades start dropping, and it's something that needs to be approached very sensitively, particularly in high achievers, because they tend to feel very embarrassed that their grades are dropping. And also their interests, they generally tend not to be interested in much of anything, particularly when they're depressed. Other red flags that can be established is personal hygiene. Dropping in personal hygiene is usually a red flag. Also, in terms of dress, just be careful with terms of dress. Just because its socioeconomic status interferes with this. So just because somebody isn't well dressed as what you'd expect them to be, it could be a socioeconomic issue rather than a mental health care issue. So it's something that needs to be dealt with sensitively. And this is particularly once your rapport is established with the patient, you can generally tease this out. Another thing that you need to be very careful about is collateral sources. So it's often, while we do have confidentiality with our adolescents, we do tell them that we do often have to phone other people to find out how other people are seeing that they're functioning. So whilst everything between the adolescent and clinician is confidential, we will phone and ask teachers, family members, and sometimes, not often, even friends, what their perception of how the patient is actually doing and how they are actually coping. Um, this becomes particularly important because in the consultation room, the teenager might actually put forward one persona, and in reality, the reality is very different. Social media posts are becoming more and more important. We've often had cases where parents have brought children in to the Division of Child Psychiatry because of social media posts around suicide, around um, depression, feeling hopeless, and things like that. So it's really important. Um, the thing is, a red flag around suicide is a teenager who's talking about it and has an organized plan. So somebody who's made a plan for what they're going to do and they don't have other plans for the future. They often give away their prized possessions. They sometimes can make statements around suicide, even in a joking manner. So it's something that you need to take really seriously. And in managing that, a safety plan and a safety net is really important. So in terms of safety plan and safety net, I'd like to think of it from the child or the adolescent moving outwards. So if the child is in crisis, who do they have within their immediate household who they can reach out for help to? So for example, if an adolescent has a close relationship with their mom, with their dad, or their older sibling, I'd advise them to reach out to that person. And okay, if there's no one in the household, do you have somebody in your school or in your friendship circle you can reach out to? Okay, you don't have anyone there, then in the societal um, structure, who do you have? So I'm going to give you guys, I'll email Tiro later, a resource pack that you can give to adolescents to help them in terms of difficulties. So the South African Depression and Anxiety Group, Lifeline, who has a 24-hour service in terms of counseling and helping people in crisis, um, and things like that. So who do you have in the societal structure that you can reach out to? Importantly, if you are scared or you are concerned rather that this adolescent is at risk of suicide, and you're unsure, it's important to refer that person on. It's not enough to give them the safety plan and send them home. I think it's important, if you're unsure, to refer them on, rather on the side of caution, just like in physical health. Unless you're really sure a chest pain is not a myocardial infarct, you will still do an ECG, you will still do blood tests to rule that out. So in the same thing, if somebody's talking about suicide and you're not sure, rather refer on for inpatient management. And the medical officers and registrars can take it on from there. Usually we have the referral systems in secondary level hospitals and in Groote as well. So in terms of the current concerns during the pandemic, we're seeing increasing numbers of depression and anxiety. The depression is around mainly the loss of what was considered normal and before. And I think what we tend to forget, that physical touch is actually something that's really important, and it's something that we can no longer do now. So you can't hug your family or your friends. You can't interact with them in the same way. I mean, I'm very grateful for technology for being able to do a talk like this over Zoom, but I think I would personally much prefer giving it in lecture theatre. So it's about grieving almost that loss of what was, and also that uncertainty of what will be in the future, what will happen in terms of the virus. Is this going to escalate? Are we going to find a vaccine? Is there going to be a cure? I mean, there's a lot of anxiety around that. A lot of people are also presenting with some obsessive compulsive behaviors. So this becomes difficult to actually state, because it's like, when is it becoming too much? But it's around the virus, around cleanliness, around washing hands. I mean, it's difficult when the World Health Organization is recommending that we wash our hands thoroughly rather, for 20 seconds. Um, and avoid touching our noses, mouths, and eyes. And the thing is that there are some people who are taking it to the other extreme and really overcautious around contamination. Um, Another difficulty is food security. A lot of people have lost their jobs, socioeconomic status. Some people who were struggling before the pandemic have now really struggling. And food security is a huge concern amongst the population that we treat. Also, some of the students are concerned about academic attainments, particularly those in key areas in their academic careers. So, for example, those who are in matric and those who are in grade 7, they are concerned about what the future holds, as well as concerns around infections and the safety of loved ones, particularly parents, grandparents, people who may have comorbidities, and they're concerned, what if my grandmother gets coronavirus, what will happen? And also concerns around friends and colleagues. Some students and some adolescents are getting very frustrated, particularly in the higher stages of lockdown, when exercise outside was not allowed. And it can become very difficult when you're all sitting in the same house, let's say mom, dad, and 4 kids, and it's a 2-bedroom house, and you're sitting there 24 hours a day. It can become very frustrating. I just need some space. I need some time to myself. I can't get away from my family. Boredom was a big thing. I'm just feeling bored. I'm just tired. I want to be able to go to school. I want to be able to do things. And then just in terms of people who have lost loved ones due to coronavirus or from any other cause, grief has also become a huge issue, but not only in terms of the loss of a loved one, but also in terms of the loss of the lives that we used to lead in the past. A lot of people are actually going through a grief process as a result of that. Okay, so here's the video I told you guys about. It's about a 5-minute video. So I hope you find it useful and that you can hear it clearly.
You can't tell how someone feels just by looking at them or what they share online. To the outside world, our lives may look perfect, even if in reality they aren't. I'm always worrying about doing well at school, and with the end of year test coming up, I'm not sure how much longer I can cope. My thoughts swarm around my head, sometimes keeping me up all night. Some days it's just all too much, and I feel like I'm lost in space. When I did badly on one of my tests, I just about kept it together until I got home. Then I broke down crying in front of my mum. She listened for a bit, and then she told me that, just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, angry, and stressed is a normal part of life, just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. These are everyday feelings. Good mental health means experiencing negative emotions. It's not always about being happy. Mum can relate to the feelings of stress. So when Mum suggested I take a break from everything and do something I enjoy, I actually took her advice. So I made myself a hot chocolate, snuggled up in a duvet and watched a film. And you know what? Afterwards I felt so much better. Mum should take her own advice.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her, so I tried them too, but it didn't make much of a difference. Even when I tried to be around my friends, I felt alone. The things I used to enjoy weren't fun anymore.
I was really worried about Andre and not sure what to do. He was quiet and wasn't hanging out with us like he used to. So I asked our head of year for some advice. He suggested I get Andre to speak to him since his negative feelings weren't going away.
I didn't want to speak to our head of year, but I also didn't want to keep feeling so down, so I went. He said that sometimes we have overwhelming feelings that can be more intense than our everyday feelings. These feelings hang around for a long time and change the way we feel, think, and behave. They can stop us doing what we want to in life. That's what I was going through. He also said that if we're physically unwell, we let people know, we ask for help. It should be no different with mental health. Sometimes our overwhelming feelings are brought on because of things in our life. Sometimes they happen for no reason at all. After hearing this, I felt much less alone and it felt good to talk. Scientists have found exercise can help when you're feeling low, so our head of year encouraged me to sign up to the school football club, which Sasha was already in. I still have days when the river is there, but now I'm beginning to understand my mental health. I'm learning how to cope. Our head of year reminded me that my friends, family, teachers, and lots of others at school are there to help just as much as he is. I had no idea the people around me could be so understanding. And while it's not always easy to talk about my mental health, the person I'm talking to might be able to help. If you don't feel like talking, that's fine. You could try writing, sports, reading, art, music, playing with your pet, whatever makes you feel better.
If you're the person someone talks to when they're struggling, just listen with no pressure or judgment. You don't have to have the answer. If you feel unsure about anything, you can speak to a trusted adult. Talking about mental health doesn't have to be difficult. After all, it's something we all have.
Okay, so that was the video by the Anna Freud Foundation. Yeah, so that essentially wraps up the talk for today. I was just wondering, are there any questions? If you guys want to type it in the comment box, or you can ask me directly. Alternatively, I just wanted to let you know that I do have some resources that I'd like to share with you guys. Just one is a list of resources that teenagers or even adults can also access, particularly if they are struggling. So it's numbers for Lifeline and South African Depression and Anxiety Group, etc. It's just that I do have another organization called Community Keepers who do provide work for certain schools in the community, and there's a list of schools as well as contact numbers. So it's only for adolescents from those specific schools. If they're having difficulties, they can contact those specific numbers to reach for help. So I'd like to share that with you guys. And there's another one called Coping with Uncertainty in Uncertain Times, done by Professor Jackie Rogers from the Newcastle University. And it's more around the coronavirus pandemic. And really, that's something I would encourage all of you to read and to share with colleagues. It's because I think for all of us during this time, just to normalize the sense that we all don't know and we all caught in the same storm, not knowing what is going to happen in the future. And it's just a way of coping. Which I think is really, really important in these times. So I can definitely share that with you guys as well.
So yeah, if anyone has questions, you can add it in the chat or just unmute yourself and yeah.
Sorry, I have a question.
Sure. Okay. Yeah, feel free, sorry, to ask.
Okay, I just wanted to ask, what would you do in a situation where a parent wants to know what you and the patient have talked about during a consultation?
Okay, so it really just depends on the issue at hand. So there's two ways to manage this. So if a parent demands to know, I'm usually quite firm, and especially if it's something not life-threatening. So for example, if it's about around suicide and self-harm, and I feel it's important for the parent to know, I will discuss that with the adolescent first and explain to them that, you know, we have doctor-patient confidentiality, but that confidentiality has limits. So if I feel that somebody is a risk to themselves or a risk to others, then I am actually obliged to disclose that to the parent. However, if it's something else, like let's say a adolescent comes to me and says that they're feeling down because they feel that they're a bit too fat, and I don't feel that it's a life-threatening thing, that's not something I would need to disclose to a parent. And I'll just explain that to the parent. And in most times, parents generally do understand that. And I explain that if I do disclose against the adolescent's wishes, it's going to destroy the therapeutic relationship. And it's actually going to be worse for the adolescent in the long run. Because it's going to be distrusting not only of me, but other healthcare professionals as well. So So it is sad. So it just depends on the context. Obviously, if there's a risk to self or others, I have an obligation to disclose, and in which case I'd inform the adolescent. If it's something not, what you call it, not life-threatening, then it's okay. All right, so we've just got 2 questions in the group chat that I'd like to address. So from Tembi Nyati, how are eating disorders typically managed, especially in relation to social media use? Eating disorders are probably one of the most challenging aspects of mental health. It's not something, oddly enough, we manage very often as an outpatient. Sometimes we manage it as an inpatient. And it can be difficult depending on the eating disorder. So for things like anorexia nervosa, bulimia nervosa, we generally recommend, although we can't police it, but we recommend social media, that the patient in question does not use social media. For the simple reason is that there's a lot of information, false information on social media, where that can actually be counter-therapeutic for the actual patient in question. So it can be very, very difficult. I mean, having said that, social media can also be a positive thing as well in terms of support groups, but that needs to be monitored. I know that there are some support groups for people who used to suffer or currently suffering from anorexia nervosa and bulimia nervosa. So that can provide a positive online space, but it's important because what can happen is that 1 or 2, when it's not policed or it's not managed properly by a healthcare professional, it can actually make the mental health of the users very, very, it's very fragile. It can, one user can actually impact everybody else. I hope that answers your question, Tembi. Okay. Okay, so next question is, if someone's mental health is not, sorry, it's from Obvious Malari. If somebody's mental health is not okay and they start taking medication for it, is it possible to go back to not taking medication and feeling fine without it? The short answer for that is, and it's going to be a frustrating answer, is it depends. It depends on the diagnosis of the actual patient. As I said, mental health is a really broad spectrum of illnesses. So for example, if there's an adolescent who's depressed and they start on antidepressants, usually the recommended guidelines state that you should continue antidepressants for at least 6 to 9 months, and that's the minimum, after the symptoms remit. So after somebody's feeling completely fine, then continuing for 6 to 9 months, and that's for the first episode. If there's a second episode, then it's something that should be continued for at least 2 years. So we usually do recommend that when people are thinking of stopping medication, that they do it in consultation with their healthcare providers, and it's done in a very measured and monitored way. So it's the patient is monitored and weaned off the medication, not something that's just suddenly stopped without any follow-up. And even after medication is stopped, somebody can still follow up with a mental health care practitioner to make sure that they're doing well without it. So yes, some patients do recover completely and we wean them off medication and they do absolutely fine and they feel fine without it. Others need a longer treatment process and input. And remember, treatment is not just about medication, it's also about psychotherapy, psychology, support groups, things like that as well. Okay, so our next question from Christine. What advice do you give the parents of managing siblings of a teen with mental health issues? Because they often get burnt out of any outlash from the teen? Yeah, excellent question. It's difficult, and this is more in the realm of family therapy, because it really just depends. Family dynamics can be very complicated even without mental illness. With mental illness in the family, it makes it more and more difficult as well. So in terms of the parents, we try to tell them that it's important to acknowledge that there is no right answer in a way. So for example, while we need to be empathetic and sympathetic to the teenager who's having the mental health care issues, we also need to understand the burden that that places on the teen without mental health care issues, and to pay attention to that and give cognizance to that. If the families of means, we'd recommend that if the siblings of the teenager are struggling, because as a result of the mental health care issues of their sibling, is that they also access some form of counseling service or mental health service for themselves, but also to pay attention to the needs of all the teenagers, all the children within the house, because there can be a sense of resentment that the one teenager is getting all the attention, and to the detriment of the others. Um, Okay, another question from Kristen or Christian. What is your role as a health professional when you identify a teenager who's being bullied quite severely in school? What do you do to help the situation? Excellent question. And essentially, in terms of bullying, it can be very severe, and we know that it can lead to self-harming behaviors. It can lead to suicide. So it's something that we take very seriously. Usually in cases with the teenager's permission, I contact the school directly, and I state that there needs to be an investigation into these allegations. It's quite difficult because you're obviously only hearing one side of the story. And whilst it's not my duty or to actually investigate the bullying claims, that is the duty of the school. So I'd usually phone either the principal or the head of department, etc., and say that these are the allegations that are being put forward. And whilst maintaining confidentiality, that my patient has been is having mental health care issues as a result of the situation at school, and please can they investigate these claims, and then I would be in touch with the patient directly to see if there's anything else that needs to be done. Okay. Okay, so a question from Bright. How can loneliness and withdrawal in social spaces be addressed? This is also a very good question. It's difficult. It's around trying to get a support network that the teenager actually feels comfortable with. And I'm not too sure if I'm going to answer your question correctly, so you can always just give some feedback. I think as much as social media and modern technology can be a burden on mental health, it also can be a really great sense of community. So there's some people who actually feel more of a kinship or more of a friendship with somebody whom they're chatting online with. Obviously, there needs to be some safety measures in place and things like that. I think that's really important. Or in certain chat groups. I know a lot of the teenagers now, particularly with lockdown, have said they've connected with their friends over group WhatsApp calls. And that has really made a difference to getting them not to feel as lonely. Withdrawal is more of a tricky one. It's more of somebody else acknowledging that a certain person is withdrawing from them. I think the most important thing, and this is actually not relying on my education as such, but more as my experience as a teenager. I think in terms of withdrawal, I think the most important thing you can do to help an adolescent who's withdrawing is just always and constantly let them know that there is help available and there are people who care about them. I think sometimes people just need their space. So saying something like, I understand that it's difficult for you now, but if you want to talk, I'm going to be here to help you if you want to, or there's other people that you can speak to as well. Just whoever you feel comfortable with and whenever you feel ready, that's the most important thing. And then the second question from Bright, considering that the Department of Health has got their hands full now, do you think health sciences students can assist adolescents experiencing grief, feelings of grief from the loss of a loved one, especially due to COVID-19? The short answer to that one is yes. I think definitely you can help. I think what we tend to forget is that, and I mentioned it in the presentation as well, is that listening is incredibly therapeutic in and of itself. It's not something, so just being able to listen to somebody's feelings of grief can really, really help considerably. And I think what my concern would be in terms of helping adolescents at this point, or the health science students helping adolescents, would be on what platform are you going to be helping the adolescents? So would it be around, would it be over telephone? Will it be face to face and things like that? Because we also need to keep you guys safe as well from COVID-19. Next question, is there a specific age at where most disorders will come up in teens? No, it's difficult. What we're seeing a lot, um, what we're seeing a lot of is that it can happen. It depends on the specific person, because there's a lot of children that are diagnosed, for example, with ADHD, and as they grow up in their teenage years, they actually become better at coping with their symptoms, so they don't need medication as such. Having said that, the short answer is to that, no, there's no specific age group, but I think in terms of, I think most of my patients certainly are between the ages of 13 and 17, which is the bulk of teenagers anyway. So there isn't a specific group. There's a lot of patients with various mental health conditions that occur earlier, and then they followed up from 30 to 17, and the evolution of the illness and the patient changes through time. So from my experience, there isn't a really specific age group where I'd worry that, like, for example, 14 years old patients are most at risk. I wouldn't worry about that. It really depends on each specific circumstance and each specific person. How should we treat someone you know is going through a hard time who has been diagnosed with depression? For example, should we be lenient and forgiving for some things that they might do that are hurtful to the family, or should we still try to reprimand them? Are we allowed to bring up the diagnosis even though they don't truly identify with it? So I think this is also an extremely interesting question, if you were. I think it's really, it depends on the specific circumstance. My understanding for this, and what I tell patients and their families, is that we should be forgiving to a point, but we should also make it clear that the mental health of the other people also matters. So for example, if somebody, let's say, is diagnosed with depression and they're very angry and they're lashing out at people, something I would say is that, yes, we understand that things are difficult for you, and I'm sorry that it is so difficult for you at this current time. However, having said that, is that it's also being hurtful to me, and it's also impacting my mental health, or it's impacting the mental health of the family. So let us look at ways where you can maybe better manage your anger. Yes, I know you're going through a difficult time, but what sort of ways would be healthier so that it's not negatively impacting the mental health of other people? The other question is, are we allowed to bring up the diagnosis even though they don't truly identify with it? My gut feeling and my experience is rather not. Because if somebody is depressed, but they don't identify as being depressed, bringing up the diagnosis is just going to put a schism between you and that person. It's not going to be good for rapport building, and it's not going to make the person trust you or open up to you anymore. If it's a family member, it's just going to create more anger. It's going to create more difficulties in relating to that person. So my answer to that would be rather not, unless it's going to be in a positive way or in a way that is going to be perceived as helpful. It's like, yes, I know you're going through a really difficult time, and we can help you, but please just be aware that some of the things you say and do are hurtful, and I need to also look after myself and my own mental health. Okay. Oh dear, I've lost the question suddenly. I'm just going to go down quickly.
I think the next question was from Zete. She said,
Yeah.
do we as health science students have an obligation to report if somebody expresses suicidal intent? And what do you think is who do you think is the best person to report to?
So that's a very, very good question. And the answer is, as a health science student, you're not obliged to report, but as a friend or as a person, it would probably be a good idea to do. I don't know if that is answering your question. You're not obliged by the HPCSA to report if somebody has suicidal intent, but that's not something that I think you should try to manage on your own. I think you should report. Again, it really is open to debate who you should report to. It depends on the person. I would like the first prize, and the best way to do it is to get the person on board. So let's say you have a friend who's saying they're thinking about suicide, they've got a plan, and you're obviously very concerned for your friend. Speak to your friend. It's like, we really need to talk to somebody. Who do you think would be the best person we should speak to? So you can approach, if the friend says, okay, my mom is the best person, or I've got a really close relationship with a certain teacher that I'd like to speak to, or somebody on health sciences, a student wellness center who I'd like to speak to, or somebody else, I think that would be the best person. The person in question would be able to point you towards the best person. Having said that, if your friend doesn't give permission, says, I told you this in confidence and you're not allowed to tell anyone, but I'm going to kill myself tomorrow. I mean, that's a huge burden to bear for anyone. So I think in that case, if you're genuinely concerned about someone, I think just like what we would do, as I mentioned, that confidentiality has limits and there are boundaries to confidentiality. I would say that unfortunately, due to the fact that this is such a serious thing and your safety is at risk, I would report to the primary caregiver of that person. If it's an adolescent, it would usually be the guardian, legal guardian or parent. If not, if it's an adult, then you can report to, depending on the circumstances, if it's somebody in university, it will be student wellness, and they'll be able to point you towards the right person to report to. Also, so I've lost my train of thought. Oh yes, depression and anxiety support group also gives support to friends of people, so they will also be able to point you in the right direction. All of that failing, if all of that fails, then you can actually take your friend. Hopefully, they'll agree to come with you to a casualty. So Groote Hospital casualty, if it's a fellow health or a fellow university student, we often see quite a few students there with suicidal intent or other mental health care issues, and we can get help from them as well. Okay, and the last one is from Tiro. Yeah.
So that has been such an interesting talk. Thank you so much, Kavi. We really appreciate you taking the time out to talk about very important things that we all need to know. And thank you to you guys for coming to attend this talk as well. I forgot to mention at the beginning that this is a collaboration between PaedSoc and PsychSoc, so we thank them as well. And in terms of the resources that Kavi mentioned towards the end of the talk, we'll be sharing it to the PaedSoc Society members and the PsychSoc members. So you guys will have those as well. And I just wanted to let you know that we as PaedSoc have started an initiative that's focused on adolescent health. So you guys can check out our Instagram page. It's at tag teen health. I'll just like type that in the group chat. And then you guys can check it out and share it with any other teenagers that you know. But thank you guys so much. We really appreciate you coming.
Okay, and thank you everyone for joining. I mean, it was an absolute pleasure. And as I've said before, I'm really glad that there are students that with such a great interest in adolescent mental health. I think it's really great, particularly now. It's much needed.
Thank
Okay.
you.
Thank you guys. Thank
All
you.
right, cheers.
Okay. And thank you so much, Kavi.
Bye.
All right, bye.
Thanks.